And welcome to this COMPAS webinar on the relationship between democracy and expertise in the COVID-19 pandemic. My name is Eric MacGilvray. I'm a professor in the political science department here at Ohio State University, and I'm the coordinator of this year's COMPAS series on COVID-19. As many of you know, COMPAS is a program of the Ohio State Center for Ethics and Human Values. COMPAS is an acronym that stands for Conversations on Morality, Politics, and Society, and the mission of the COMPAS program is to promote informed and civil discussion of important and controversial public issues. Obviously, the COVID-19 pandemic is one of the most important and controversial issues facing our nation and the world today. And today's panel is the fifth of an ongoing series of COMPAS events that explore the ethical and political dimensions of the pandemic and the response to it. We're hosting panels like this one every other Friday from 1 o'clock to 2 o'clock Eastern Time on Zoom. Our next panel on November 13th, which will be the last one for the fall semester, is called Can the Government Really Do That? Emergency Powers in a Democracy. You can view the full schedule and find information about our many distinguished panelists. You can also view videos of our previous events on our website, cehv.osu.edu/compass. It's a great lineup of topics and speakers, and I hope that many of you will be able to join us. Today's panel, Who Voted for Dr. Fauci? Democracy and Expertise, is moderated by my colleague, Michael Neblo. I'll let Michael introduce our panelists, but first let me very briefly introduce him. Michael is professor of political science here at Ohio State, where he directs the Institute for Democratic Engagement and Accountability, and is also a member of the steering committee for the Center of Ethics and Human Values. He's a political theorist and political psychologist whose research focuses, among many other things, on using deliberation to improve representative democracy. Michael, take it away.
Great. Thank you, Eric, and thank you to all of you who are attending today. I am very excited. We have two distinguished guests today who are experts on expertise. So we've got a little bit of reflexivity going here. Our first panelist, Dr. Alfred Moore's work in political theory focuses on deliberative democracy, social epistemology, the politics of expertise, and technology in democracy. He was a research fellow at Cambridge University working on a project called Conspiracy in Democracy, History, Political Theory, and the Internet. He has a PhD from the University of Bath and has taught philosophy at University College Cork, held a European Union Marie Curie Fellowship, and was a Democracy Fellow at the Ash Center for Democratic Governance and Innovation at Harvard University. He has also published very widely in a range of journals, most recently in the British Medical Journal on the topics that we'll be talking about today. In his work on the problem of expertise in democracy was the subject of his recently released book, Critical Elitism, Deliberation, Democracy, and the Politics of Expertise from Cambridge University Press. Thank you very much for joining us, Dr. Moore. Dr. Paul Hahn is director of CORE, a behavioral and health services researcher and a board-certified general internist and palliative care physician at Tufts University. He received an MD from New York University School of Medicine, an MA in bioethics, and an MPH from the University of Pittsburgh. He completed internal medicine residency training at UCLA and was a fellow in cancer prevention and control at the National Cancer Institute. Dr. Hahn's research focuses on understanding and improving communication and management of uncertainty in healthcare, and his work bridges the disciplines of health services and behavioral research. His specific research project focuses on risk communication, shared decision-making, and predictive modeling, and examines various clinical problems in cancer care, genomic medicine, and palliative and end-of-life care. His clinical activity is in palliative medicine, and he is an attending physician at the Hospice of Southern Maine. Dr. Hahn is actively involved in initiatives to promote shared decision-making and to teach risk communication skills to medical students and physicians. He is currently a member of the editorial board of medical decision-making and an external advisory board of the NCI Cancer Research Network. Thank you both very much for joining us today. Before we jump in, I'm just going to say a few words about the format of our forum today. I'm going to invite each of our panelists to just introduce themselves and the problems in their work as they think about them pretty briefly to set up a discussion. Then I will prompt an open discussion between primarily our panelists, but I might jump in here and there as well. Then we'll move to a good chunk of our time remaining for Q&A. And I'll just mention that the question box is open and you can start submitting your questions at any point. We have people on the back end who will be curating those and we'll post them up forward when we hit the Q&A session. So Dr. Han, why don't we begin with you? Take us away.
Great. I just want to thank all of you and Michael, the organizers of this forum, for the chance to be here to talk to you about this topic. It's quite an honor. It's also a bit out of my usual audience that I talk with, but I love engagements like this where we can engage in some interdisciplinary conversation about particularly a topic as important as this. So what I want to talk about briefly, and these remarks are really just going to be to set up hopefully some points of discussion, but I want to talk about the need to communicate uncertainty, scientific uncertainty, in public health crises such as COVID-19. And obviously this is the most important crisis that we're all facing as a nation and a country. And I think that the whole topic of communicating uncertainty in science is necessary both psychologically and morally. And I'm going to talk just a little bit about a few of those reasons. But that the problem is that we also know that communicating uncertainty has many aversive psychological effects, and that these effects really raise the need for effective ways of managing uncertainty. And unfortunately, we lack those at the present time. There's a lot of promising work that's been done to look at different strategies to use to help people manage and tolerate uncertainty. But to me, this is really the whole rub to the problem of dealing with scientific uncertainty in a situation like COVID or any other public health crisis. And so I want to talk a little bit about what those problems are and what some potential strategies are, but to sort of back up a second and also practice what I preach, I want to just preface my remarks by saying that I'm not going to solve any of our uncertainty today. I'm really going to just point to some areas of perhaps future research and future dialogue and how we can deal with our own uncertainty, but I'm not going to offer any necessarily answers or resolve your uncertainty. So I just want to set those expectations up front. What I want to talk about first is first to lay out a definition of uncertainty so that we kind of know what we're talking about. And the way I think about it, which has been derived by some conceptions that a few other social scientists have put forth in the past, is that I think of uncertainty as signifying a metacognition. So it's a reflective kind of conscious awareness of ignorance. And that could be scientific ignorance, it could be one's personal ignorance. But I think that this kind of metacognitive conception of uncertainty is useful in some ways. And so that's how I've tended to think about the phenomenon of uncertainty, whether we're talking about clinical care or public health crises, or just individual health problems that patients and clinicians deal with. Uncertainty is obviously conceived in this way, that is, uncertainty is really a ubiquitous and an inseparable part of all health problems. And if we think about the COVID-19 crisis in particular, uncertainty really pertains to every aspect of this disease and the pandemic, from its nature, its etiology, its diagnosis, its prevention. So what sorts of risk-reducing behaviors are effective or not, and including some high-profile things like mask wearing, for example, but also its treatment and the efficacy of vaccines. Those are all kind of major issues of scientific uncertainty that COVID-19 raises. But then there's a lot of moral problems as well. So how do we balance the desire and need to control the pandemic through public health measures against other types of societal values, economic and otherwise? And so COVID-19 obviously raises a lot of uncertainties that are not strictly scientific, but moral in nature. But all of this and more is really encompassed by a public health crisis like COVID. The problem is that when a lot of times in the way that both government officials, medical experts, others deal with these kinds of uncertainties, they're not often made explicit. They're not talked about in a direct manner. They're talked about indirectly, if at all. But they do surface, and they surface in times of disagreement, particularly when there's disagreement either between experts or between, say, scientific or medical experts and political or government officials. But the uncertainties often manifest in the form of these disagreements. And this is when people really then achieve that metacognitive awareness of ignorance or uncertainty, as I see it. And so what often happens is that this state of shared uncertainty that occurs in society or in communities is happening indirectly. It's happening unintentionally, but through these disagreements. And the question is, so what do we do about that? There's a lot of arguments, though, that as I've defined it, uncertainty as a metacognition, there's actually good reasons to believe that it's not really a negative thing. You know, although we often have a gut reaction and we tend to view uncertainty as negative in nature or aversive, and I'll talk about that more in a second. There's actually good reasons to promote uncertainty or to actually allow disagreements to be voiced and scientific limits and evidence to be made explicit. First of all, from a psychological point of view, people need uncertainty. They need to be able to calibrate their actions according to the quality of the information or the evidence that's available. So that's actually a major psychological reason where uncertainty is actually necessary. We need it to make good decisions. We need it to exercise caution. We need it to know when it's time to seek more information and defer decision-making, or to go ahead and make a decision and to be confident in it, and to calibrate our level of confidence. There are also moral reasons to favor this state of shared consciousness of ignorance or uncertainty. There's the whole ethical principle of respect for autonomy or people's right to self-determination. Expressing uncertainty and making disagreements known helps people to also understand whether, and also make decisions as well as understand based on their own appraisal of the situation, and to form judgments about whether the existing evidence is sufficient to justify taking action. And then it also, communicating uncertainty also allows people to sort of express their own interpretations, their own perspectives on whether action is justified. So for all these reasons, I think there's psychological and moral, there's a lot of strong arguments to really be open with communicating uncertainty and to help people achieve this shared consciousness of ignorance. The problem, though, with efforts to do this, and I've spent my career trying to figure out how to promote the communication of uncertainty between clinicians and patients. And there's a large movement in medicine called shared decision-making, which is really premised on the whole notion of open communication, sharing in this awareness of both existing knowledge and existing ignorance, and helping patients make better decisions. The problem with this, whether we're talking about in the clinical kind of individual care situation or in the public health domain, where we're dealing with the general public and communities of people and measures to control an illness like COVID on a larger scale, which can involve limits on individual freedom. Even in that setting, the whole issue of communicating uncertainty becomes complicated because we know that it has many, many negative psychological effects. So even though it has positive effects that I've enumerated in terms of the sort of metacognitive virtues of uncertainty, we also know there's a tremendous amount of evidence that shows that it's psychologically aversive to people. It leads to heightened perceptions of vulnerability, fear and anxiety, decision avoidance, deferral of decision-making. There's also mixed data, although some data, that it can lower the public's trust in experts and in evidence. And it can lead to polarization and a lot of other phenomena, stigmatization, et cetera. And there's a lot of evidence from both decision psychology and behavioral economics that have documented all these types of effects. So it seems to me that although we have a lot of good psychological and ethical rationales to be open and to communicate uncertainty about public health crises like COVID, and we know the virtues of doing so, we also know that when we do that, we're going to make people feel worse, and people are very averse to uncertainty of any kind, and they're going to experience negative psychological effects. So then, to me, the real problem is, well, how do we manage those negative aversive effects of communicating uncertainty? And how do we actually improve people's ability to not only acknowledge uncertainty, that is, to be consciously aware of ignorance, but to somehow tolerate the negative psychological effects of doing that? And to me, that's where the biggest evidence gap is, and that's also the most problematic aspect that we don't yet know how to deal with. There's been a lot of efforts to communicate uncertainty, for example, to not only patients in medical settings, but to the general public. And there's been guidance put out by groups like the US CDC and their crisis communication guidelines, where there's, I think, a consensus that we need to be transparent, we need to acknowledge uncertainty, communicate it. And yet there's a tremendous lack of evidence, in my opinion, empirical evidence about exactly how to do that. And so what I want to do just in the last couple minutes is just to acknowledge my uncertainty and our uncertainty about how to deal with uncertainty, but also just to suggest that there are a few ways, in my opinion, that are promising and that represent avenues for further research. One of those, I think, is to focus on developing messages and messaging strategies that actually try to normalize uncertainty, to sort of set epistemic expectations that don't treat uncertainty as if it's necessarily a flaw, or simply a deficit state that needs to be reduced, or that points to somebody's culpability, and to achieve some sense of normality in terms of expecting uncertainty and disagreement, for example. And I think that there are some ways, and my own group has done some studies, even with COVID, that we're going to hopefully publish soon, that shows that these sort of normalizing strategies can actually reduce some of the aversive effects of uncertainty. But I think that this raises an even greater need that's upstream of any efforts connected to a specific intervention for something like COVID. And that is for more broad-based science education, but even more than that, just epistemological education of the general public and of people at all levels of education, to kind of think about how we set more appropriate epistemic expectations, and how we make or foster a more mature, I think, perspective on the nature of truth and of scientific knowledge. And so I think that these things, point to deeper, broader needs. And I also think that one avenue of work is conceptual, in that we need to derive, I think, a normative framework for how to approach the communication of uncertainty. What's the goals? What sorts of overarching kind of moral goals should guide this, other than the idea of, excuse me, setting epistemic expectations, but things like looking at fundamental values like humility and flexibility, and how do we derive a coherent moral framework that can push us in the right direction and sort of guide these efforts to manage uncertainty. And what we ultimately need to do is to be moving more towards an uncertainty tolerant society. And I think that's where this sort of really balloons and I think can encompass a lot of things that are well beyond my expertise and even talking about. But those are just some of the thoughts that I want to introduce, and look forward to discussing these things further today with you. Thank you.
Thank you very much. That was terrific. I appreciate those comments. Alfred.
Yeah, thank you very much. And thanks, I say thanks as well to Eric and to you, Michael, and to everybody involved in COMPAS for inviting me today. I'm really grateful to be here and talking about this issue. And as Michael mentioned at the beginning, I've worked in the past, I've done work in political theory on the relationship between expertise and democracy. And obviously the COVID pandemic has brought this kind of relationship to the front of people's minds. But in a sense, it's a very old question. I mean, we could obviously go back to Plato, but a bit closer to home, you know, we could just go back 100 years ago to someone like Max Weber, right, who gave these two famous lectures on science as a vocation and politics as a vocation to students in Munich. And one of his key points that he laid out, and really in both those lectures, was that science and politics don't mix. Right? Scientific facts alone, he said, you know, cannot determine how political or ethical or moral judgments should be made. And so this kind of, idealized separation of science from politics is a sort of guiding theme in a lot of our intuitive thinking about how science and politics ought to fit together, right? It should be informing, but not deciding. So it's an old problem, but in another sense, when we talk about the political problem of expertise, you know, as we do in the top of this session today, expertise is a very new term. I mean, it was only coined in the late 19th century and not used very much, right? But then really came into widespread use through the 20th century, and particularly in the 1960s. And if we ask, like, well, why does it take off? Various kind of explanations have been given, among others, that it's partly to do with the expansion through the 20th century of the administrative state, which brought with it a lot of disputes about the authority of experts in policymaking and regulation. So, you know, there were Supreme Court cases arguing who had the right to speak authoritatively on certain technical questions. But it's also partly to do with a rise in kind of cultural and social power to contest claims to expertise. So think of social movements for patients' rights, which particularly started to grow in the 1960s. And so what I mean to do here is just to say, well, look, we might define expertise in general as, you know, dictionary definition as a sort of skill or knowledge in a particular field. But as one sociologist recently put it, the term is kind of essentially contested. Like, it's rooted in contexts, in political contexts where it's not clear how to decide between competing claims to expertise, and it's not clear who can claim to be an expert. And I should say as well, in just these general kind of remarks on expertise, that these are not contexts where we're dealing with something like pure science, right? So in the kind of stereotyped vision of pure science, where research proceeds without any pre-given endpoint until a kind of clear consensus emerges. What we're dealing with in the sort of context in which the term expertise started being used were contexts where decisions needed to be made right now, under pressure, under pressure for decisions, drawing on claims from many different disciplines often, claims in which there's a great deal of uncertainty, but a need for something to be done, a need for a temporal limit. And in these cases, it's much harder to draw the kind of clear lines between reporting the facts and thinking about what we value and what we want to achieve and what our purposes are. So even if we want to follow Max Weber's advice about not mixing science and politics, when we talk about expertise in politics, we find them blurring into each other. And so I've been struck thinking of COVID. It's not clear where expert authority stops and political authority starts. And I think of all of those images of elected leaders standing next to medical and scientific advisors at press conferences, sort of blurring that line and raising the question, are we supposed to be obeying the experts or the political leaders? Whose authority are we under at this point? And so that kind of blurring becomes really problematic and really visible. So with that general throat clearing, with that general sort of theme in mind, I want to say a few words about a particular problem with the political use of expert authority. And I think two problems really. One of them in which unwelcome expert advice is dismissed because it must be politically motivated, a political hit job, something like that. And one in which expert advice is more or less slavishly followed or presented as though it's being followed. And so in a piece that Michael mentioned in the BMJ that my colleague Michael Mackenzie at the University of Pittsburgh wrote with me, we argued that both of these positions like implicitly deny the importance of legitimate expert disagreement, right? Either by saying that disagreement must be politically motivated or by attempting to mask any disagreement, to make it seem like there is a clear and consensual science we could be following. And so, I mean, what we argue in a nutshell in that paper is that if scientific advice could be structured so that it's both diverse, that is, drawing on a diverse range of experts, perhaps not just virologists and epidemiologists, but child welfare experts and more and more. If it's structured so it's both diverse and that it encourages open disagreement among experts, that is, where experts do not attempt to form a unified consensus position, but rather try to kind of organize and communicate their disagreements and uncertainties and the reasons for their disagreements, that if that kind of diversity and open disagreement could be structured into expert advice, then it would be a lot harder for political leaders to either dismiss expertise because they disagree with it, or to use it as a shield to make it look like they're not making decisions at all. Right? It would make it harder for politicians to say they're just following the science if there was a kind of open and structured disagreement. Now, our call, like when we talk about the need for diversity, that's quite widely accepted and relatively uncontroversial. But the call for open disagreement, particularly open disagreement in the kind of context that we're thinking about, right? The kind of context of expert advice in a crisis situation, it's a bit more contentious. So before I close, I just want to say a few more words about what we mean by open disagreement, or rather what we don't mean. So we don't mean what usually goes under the label of transparency. So things like making available the minutes of expert committee meetings, or making FOI requests to read people's emails, or instantly publishing all of the various bits of evidence on which a group of experts have based their judgments. So one editorial in the Spectator magazine in the UK, a weekly news magazine, argued for precisely that just last week. But we think that that would open the door to a kind of cherry picking of information to support partisan positions, and more generally to the loss of the very thing that we want from experts, right? Which is the ability to weigh and interpret complex and incomplete and uncertain information. So we'd sort of lose the thing we want by aiming for transparency. So what we mean by open disagreement is more like making public kind of considered expressions of disagreement. And we talk about a few ways that this might be done, but one would be to encourage a practice on expert committees of, say, producing minority reports, sort of on the model of Supreme Court opinions. Another might be to use votes as a way of making visible the levels and the shape of agreement and disagreement among experts on particular issues. But the point in either case is to kind of think creatively about ways to make public the reasons and rationales behind such disagreement. And so essentially, you know, we sort of think that would make it easier for experts to stay true to their expertise and harder for politicians to hide their judgments behind the science. So I'll stop there, in fact, and then, yeah, and I really look forward to your questions. Thanks very much.
Great, thank you. Well, I hope all of you are seeing how well matched our two experts are to bounce off of each other and set up what I think is going to be an exciting and fruitful discussion. I see that a few questions and comments are already rolling in. Please do continue to submit your questions and comments, but we're going to spend a few minutes now with me just prompting a few connections between our two experts to get the discussion going, and then we'll turn towards your questions and comments. So the way that I want to set this up is just to note that in the clinical context that Paul was talking about, we can cut out the middleman, so to speak, regarding shared decision-making, in that it's a direct relationship between the clinician and the patient. But in the public health and larger policy context, we have a three-way interaction between scientific experts, politicians, and the public. And I don't know if this is provocative or obvious or something or wrong, but I want to toss out that politicians might be conceived of as a kind of expert on staging the value trade-offs that link up to the scientific and technical matters, and also as filters and interpreters of the technical and scientific expertise, especially as they link up with the value trade-offs that they're staging. And that's where I think things get complicated. And I think this is, in a way, just restating some things, some themes that were already brought up, but just trying to really sharpen them a little bit. And in particular, I just want to prompt each of you to talk a little bit, in Paul's case, how the disanalogy works between the clinical context and the public health and policy context. And for Alfred, the ways that attentional problems, attention as in, right? So I really enjoyed and admired the BMJ piece and think that that's exactly where we should be going. But I tried to put on a skeptic's hat a little bit along these lines. And I could see somebody claiming that on the margin, yes, this would make it harder for elites to weaponize or hide behind even fringe disagreement in the scientific and technical community. But that given that people have day jobs and are bombarded with this, and the incentives in some cases are so high to jam the signals that are coming, that it would really only be the most attentive people who would benefit from the structured disagreement as opposed to standard transparency. And so I guess I just want to prompt you to reflect on that, in whether knowing that under standard, at least under status quo conditions, that we're likely to be able to weaponize this sort of information and induce jamming, muddying the waters in the public, whether and to what extent that militates against even open disagreement, even more so than standard transparency. Not so much that it overcomes open disagreement, because I think I agree with both of you, there are powerful reasons to set that as a default, but the extent to which that might push us off of open disagreement and even standard transparency, especially in cases where it's easy to muddy the waters, B, where we have near scientific consensus. We never have complete scientific consensus, but near scientific consensus in three really high stakes situations. So here I'm thinking, for example, of like climate change, which we don't have to, I know you're not experts on climate change, but okay, that was kind of a convoluted set of comments and questions, but I'll let you, whoever would like to go first, take a crack at that.
I mean, maybe then shall I go first, just because I think your question's fresh in my mind. I mean, that's a really good point. So I mean, I take two thoughts from this. So one of them is, as you say, I wouldn't go with you in framing politicians as being experts in presenting or making value trade-offs, just as I feel that might stretch the concept of expertise beyond what's particularly sort of useful. But if we do think of that, but I do think it's reasonable to think of that as their role, right? As having a role of clarifying value trade-offs and essentially taking ownership of political judgments. And to some degree, and again, think back to Weber or something, we might frame that as a matter of ethos, right? We might frame that as like, we want good politicians. And it's just, and what do you do to make sure you get a Jacinda Ardern and not someone else, right? And if it's a question of the ethos and conduct of particular politicians, that takes us down a road of looking to those individuals, looking to how they perform, how they behave. And what we try to do in the paper, at least, is bracket some of those problems and think of institutional design, things we could do institutionally to change the sort of, not incentive structure exactly, but to change the context in which politicians are making judgments, to make it slightly harder to fall for the temptation of hiding behind of certain ways of presenting expertise, and to make it harder to avoid taking responsibility for those judgments. But I take it that the second part of your question, to sort of how far is this going to enable people to jam the signals and muddy the waters, right? Is openness about disagreement of the sort that we think, an openness about uncertainty. Like, does it offer opportunities for people to manipulate or, and in a way I'd say, well, yes, that is a concern, but my suspicion, and I think our suspicion as well, is that if we had considered and credible, diverse expert judgments on particular, where there are significant differences, right? Where there are particular differences, it would actually somewhat crowd out the space for other actors to fill in the gaps. So I think one of the risks of taking, for instance, taking the diversity of expert opinion and the disagreement and the uncertainties that are voiced in the room, and then presenting to the public a unified front, right? That has a kind of intuitive appeal as a way of projecting authority, but it also leaves the field entirely open for others to put together their alternative positions. And if you had our thought at least is, if you had a diversity of credible minority opinions, for instance, you'd find a way for an easier anchoring around credible diversity of opinion, and perhaps less space for the less credible diversity of opinion, so to speak. So that's all I'll say on that. But it's yeah.
So I would comment, and I'd have to say both of your comments are extremely thought-provoking. And I feel like, Michael, the way you kind of put it, this in terms of a three-way interaction in the public sphere that we don't really have in the clinical sphere when we're talking about being kind of open and sharing uncertainty and communicating uncertainty, I think is a really interesting point. And it's making me think of the fact that, and also your comments, Alfred, I think there's just fundamentally some human cognitive limits to our capacity to handle uncertainty, to actually acknowledge it and to deal with it and to be open with it. And even in the clinical sphere, I should have prefaced my remarks by saying that, shared decision-making is a nice concept, but it's not really realized. We're nowhere close to realizing that in clinical care for a number of reasons. And it's a big movement in medicine, but I think most people would say that we have a long way to go with that. And I think part of the reason is these fundamental limits. Some of them are practical. What can you do in a clinical conversation that's 15 minutes long in terms of engaging a patient? But I think it's even more than that. And I think this is where there is an analogy in the public sphere that kind of maps a little bit better, because we know that even in the clinical sphere, people there's just a limit to how much uncertainty a patient and a doctor can handle. So we resort to using heuristics, and we resort to using all kinds of shortcuts and patient navigators, they call them, and family members and other things, because in the end, I think that there's just some very real fundamental limits to how much detail and precision we can have in our knowledge about our ignorance. And I think it gets to be too cognitively burdensome. So people, even though shared decision-making is a nice ideal, it's an ideal. We're trying to approach it, but we will only get so far with that. So I think that when you mentioned the politicians being kind of like the third wheel or the sort of interacting person, I think there's a lot of analogies with that in the clinical setting. And I think people in the end need somebody to help them translate all of this uncertainty and to reduce it to something that's manageable. And I think that's where, whether it's politicians or whoever else, serves that purpose, there's a reason they're serving that purpose. And you could argue and ask questions about who is the right person to be that navigator. I would say that some politicians are probably better than others, but it's pointing to a more fundamental need, I think, and that is that there are just inherent limits to how much uncertainty any of us can really handle. And I think that whether we're talking about clinical medicine or public health, or other realms, I think we haven't figured that out. Like, how do we give people, the assistance they need to really manage and tolerate uncertainty? So I'll end there.
That's super helpful. Thank you so much. I'm going to ask one more question, and it'll be a little bit crisper than my rambly first question, and then we'll turn it over to the Q&A. I'm interested in whether you think there's anything promising about what we might call a second order kind of democratic authorization towards rolling back imperfect technical transparency in light of the known effects that Paul and others have identified, right? So it's possible that as a polity, we could decide that we're just going to empower certain sorts of boards of experts. They can hash it out themselves, but then they present a united front. And maybe that's through the National Institutes of Health, or that, in the health domain. Or another possibility that Alfred and some of you know is dear to my heart is deliberative forums, where we create a small replica of the public who really does have the time to overcome the intentional problems associated with jamming and having day jobs, and perhaps empowering or otherwise elevating the voice of those sorts of forums in order to help mitigate the kinds of challenges that force balancing on this that we've been talking about.
Yeah, I guess I'll go first this time, Alfred. I mean, I agree. And in medicine, clinical medicine and public health, there are organizations and bodies and groups that have been formed to do exactly that. You all in the fields you're at, I think can kind of look with more sophistication at the sort of moral justification and the practical issues involved in implementing systems like that, where bodies are entrusted with doing a lot of that sausage making in terms of synthesizing evidence and dealing with all the murky, uncertainties, about things, but trying to come up with a product that is, accountable and trustworthy, and that people can have confidence in. I think something like that, some system like that is necessary, and it's been certainly, these things are being tried in clinical medicine and in public health. There's a lot to think about in terms of, what bodies get legitimized and what don't. And I think that's where the rub is.
I agree. That's another great question. My concern, when we think about, and I'm very sympathetic to the idea of, for example, citizens' assemblies or citizen forums of various kinds playing a role in these contexts. But one of the problematic things about the context that, we're thinking about right now, COVID, temporal compression. This is something where there isn't the time for a kind of unfolding of careful public construction of positions, and it's one in which, the same reasons that make it so difficult from the point of view of uncertainty and gathering knowledge for decision-making processes are the same conditions that make it really difficult to do things that we would ideally like to do, like let things unfold and breathe and engage publics in a certain way. And so, the instinct, and certainly I think political instincts during emergencies are to try to close the doors, to sort of to hoard information, to try to contain, and control the flows of communication, and these kinds of. So in this precise context, it makes it a very difficult context to do those other sorts of things. I suppose, and that's why. Where one place I do think that kind of critical public reflection could come in is at the sort of meta level, right? Of thinking about how we should organize credible and trustworthy uses of expertise. How we can have that in place to be drawn on. But I mean, I think just to say one final thing before we go to more open Q&A, just thinking back to one of Paul's opening comments, and I think there's a really interesting. There's a really interesting problem of how individuals handle uncertainty, and how far we can expect uncertainty to be processed by others. And I know it's a sort of broad-based and sort of quite structural sort of solution, but to aim for something like a change in the ways in which we set our expectations for uncertainty, and I don't know how to do that, right? And I don't know what exactly, but I think aiming for something like changing the sorts of expectations people have about what expert authority should look like, that it should look unitary, that it should look certain, that it should appear like, like a kind of age-old father figure, but how to change expectations and to create public expectations of a legitimate degree of uncertainty. And so just to say, I agree that this is a major challenge.
Great, thanks for those engaging responses. Okay, so we're going to turn it over to the audience Q&A. And this first question is, during the introduction, it was loosely alluded to that this webinar would be a discussion by experts about experts. As experts in your own right, how do you as individuals go about avoiding or minimizing your own biases and overconfidence in your lives and work? Further, could this be applied on a structural level, or is there only ever an emphasis on the individual to and to want to be self-aware?
Wow, that's a great question. So I heard both a professional and a sort of personal dimension to that question, and I think that they're linked. And I think, at least for me, I think the reason I actually study uncertainty, and I've always been interested in it, first when I was a clinician, just experiencing medical uncertainty and how gray clinical practice is. But, for me, for some reason, I've been sensitized to that. But I also have come to the belief that that's one of the most fundamental needs in clinical medicine, and or I would say public health. Anytime we're dealing with an applied, type of endeavor that's affecting people's lives, that there's actually a compelling need, as I said before, more in kind of clinical terms, but it applies to personal life as well. I think there's a need to be self-reflective and to be aware of our limits. I think that's just such a fundamental part of living life properly, as well as approaching, one's own, profession, and especially if it has to do with research or clinical care. So, my own, reaction to that question is, it's an ideal that I feel like I strive for in terms of, trying to be self-reflective and aware of my own limits, whether it's in my personal life or professional life. And I think that that's the kind of thing that I think could serve as a normative kind of goal for a lot of what we do in lots of different human endeavors. And I think it points, though, to other deeper kind of moral values, as I mentioned at the end of my remarks, like humility and flexibility. And I just think that that's what I was alluding to, that I think, some kind of a framework where we kind of think about those kind of very foundational values is important. So I don't know if that answers the question, but I mean, that's just kind of my reaction to that sort of both professional and personal, aspect. And I see this and these discussions about COVID and other things just simply are manifestations of a deeper need, for uncertainty in the metacognitive sense that ties into these deeper values.
And I completely agree with Paul's response. I mean, in the sense that at a, in a personal level, yet, I too would hope that I, at least strive for a kind of reflectiveness, about limitations and biases. I'm also wary, though, of the risk that we can slip into quite personalized sort of counsels of perfection, and that I try, and I might try to do that, but equally, a lot of say in my professional context, right? There are mechanisms and structures in the architecture of professions, right, and in the architecture of social engagement that check against that, and that it's not all on. I'd say it's not all on me. I mean, like, I might try, but equally, a process of anonymous peer review is a structured check on bias, right, in a certain way, and submitting to those and being reflective about how those procedures are working, I think is another layer of that kind of duty, right, to reflect on how our institutional and structural sort of contexts support that, that kind of danger, that risk, that sort of basic human risk that we all face. But thank you.
Terrific, thank you. So the next question reads like this. Both speakers have pointed to a need for the promotion of uncertainty, yet it seems, at least to me, that the primary political use of uncertainty in recent years has been in bad faith attempts to exploit it to delegitimate action on smoking, climate change, etc. So how do we take account of these bad faith political actors' exploitation of uncertainty if it becomes more widespread? And my gloss on this, if I'm understanding the questioner's question on this, is that there's a political asymmetry in how this works. The questioner is trying to surface here that it's conservative, small c, not as a political movement conservative, but that uncertainty is used to block change, whether that's change in a traditionally progressive or conservative direction.
Yeah, this is a great question. It's been on my mind a lot, and there's a lot of really nice work done. There's a group of scholars who have been advancing this field of agnotology. David Michaels and others have written extensively about the strategic uses of uncertainty in kind of social settings to advance agendas, big tobacco, climate change, whatnot. So it's definitely true, and a great point, that uncertainty can be misused and weaponized in many ways for other ends. And you can also see that it's used in all kinds of ways in clinical practice as well. And I would argue that in some ways it serves very fundamental human needs, like the need for hope, for example, if somebody is facing a poor prognosis. And so uncertainty serves strategic needs and ends. How do we discriminate between desirable and undesirable ends and so forth? I think that's a really big question that I don't know the answer to. I think part of it gets to how do we, again, to the point we talked about before, and Alfred just mentioned a little while ago, so how do we get people to sort of think more and have the right sorts of expectations about expertise and about evidence and data, so that people are more on the same page and just realize that, yes, even the realization that uncertainty can be weaponized and used for different purposes, I think is a more meta, sophisticated way of looking at uncertainty even. So we need to sort of even have a metacognitive awareness of uncertainty itself and the way it's being used. And maybe if there's ways of institutionalizing that kind of knowledge through different processes, or also raising awareness and helping people have a more epistemically mature perspective. Again, I think this gets to education, and maybe there's also structures and processes that could help institutionalize that higher level meta awareness. But I don't have the answer, but I think that's sort of a direction we need to go in. I don't know what, Alfred, do you think?
Yeah, I was thinking of similar kind of work around agnotology. I was thinking of the work of, say, Naomi Oreskes and Eric Conway, who've done, some really interesting work, again, about the weaponization, the political weaponization of uncertainty to frustrate legislative and regulatory action against some kind of environmental threat. in those particular cases. And I'll just say one thing briefly on this. I think in a way, the kind of some kinds of weaponization of uncertainty actually trade on expectations of consensus among scientists. So part of the reason that very fringe opinions get an outsized influence is through a sense that they demonstrate the negative, right? They demonstrate that there is not a consensus, and they don't have to do much work in making a persuasive position of their own, right? All they have to do is create little shadows of doubt. But that maneuver depends on an expectation of unity, unanimity, consensus, right? And so I sort of see it slightly different, that if you could somehow establish a different relationship, right? a different expectation regarding uncertainty and the completeness of the kind of knowledge that we want to draw on for policy, then finding the one scientist who disagrees would have a lot less purchase. And so some at least, now that's not going to remove all of the incentives, all of the dynamics that go into nefarious influence, like in knowledge production and knowledge for policy, right? It's a huge practical and theoretical problem, but that's just one brief comment on it that
Okay, I think I'm going to try to squeeze in one more question. I'll be quick, and I'm going to edit it down a little bit and ask that your responses be admirably crisp as they have been. We've been talking about the distinction between expert and political perspectives, but which experts we consult suggests a value judgment in itself. For example, if we think of immigration as a legal issue, we'll likely ask legal experts about the obligations under international law. If we think of it as a security issue, we'll likely ask experts on security, and so on. So I'm curious about how you think that these value judgments in even setting up the issue of expertise ramify through your perspectives.
Yeah. If I go first, that is a really great question, because, and it gets to the point that I was trying to make at the very beginning, that there are multiple ways in which expertise is not going to be value neutral in a sort of way we might naively expect or hope. And that part of that is going to be through the very framing of a problem. And we know from more broadly thinking in political science that the framing of an issue is one of the most important ways of setting up and structuring the subsequent debate and influencing the ways in which decisions go. If, as he says, if something's framed as an economic issue rather than a security issue, it opens up an entirely different field of questions. And so there's going to be power struggles and power plays at that level. How to solve or how to address that? Again, I'm going to retreat to the sort of my generic claim that if we can bring to the surface the kind of assumptions at work in those choices and make those discussable, to make it so that it's not a sleight of hand that the issue gets framed in a certain way and appears naturally to us in that way. And one of the ways, practically speaking, to do that is to encourage a diversity or encourage competing ways of framing an issue so that it becomes apparent that there's more than one way of framing this and more than one set of credible expert voices we might want to draw on. So again, I'm going to just, hashtag, like what I've been like confirms my prior, assumption. But that's the way I would at least try to think about that challenge. But it's a serious and kind of, a very serious problem.
And I would just retreat to the optimal position of agreeing with Alfred here. So deferring to him, I agree.
Terrific. Well, I want to start by thanking all of our attendees and then ask our attendees to join me in thanking our panelists who just did a great job, I think, in stimulating deeper and interesting reflection on these important issues. I want to thank Eric, Piers, and all the folks at the CEHV and COMPAS, and hope that all of you have a terrific weekend. We can sign off with that. Thank you very much, and bye-bye.